All right.
Okay, we are ready to go. Good evening, everyone. Today is Tuesday, August 17th. This is a special meeting of the Litchfield Elementary School District Governing Board. Before we get started, I hereby call this meeting to order. And before we get started and jump into our agenda for our action and discussion items, I wanted to make sure that people were aware that at special meetings and study sessions, our governing board does not invite public comment. That happens at our normal Tuesday general meetings of the governing board. So we had some questions earlier about that on our agenda. So we will jump right in. We have only one item tonight to discuss. It is the discussion, consideration, and if deemed advisable, possible action regarding amending the district's plan for reopening. And I will start with Superintendent Gunning for a brief presentation, and then I'll open the floor to the board for discussion.
Thank you, Madam President, members of the governing board. I thought it would be helpful if I just shared a little bit of data to give you some information and things to think about as you will begin discussing the option of having a mask mandate. Wanted to let you know that I pulled some data and looking at active cases. And last year, when we looked at the highest number of active cases when we were in person, that highest number that we reached, which was in the middle of April, was 22. And we are currently at 72 active cases now within the second week of school. The quarantine cases last year, once we were back in person, the highest number was 156. Currently, we're at 494. Last year, we did not have any outbreaks. This year, already in the second week, we have 4 schools which have had outbreaks. The community spread or the community data within our district is 21.6% positivity and 395 cases per 100,000. In January of last year, which was our highest time frame, we were at 12.8% positive with 591 cases per 100,000. So I thought that information was helpful for you as well. Some additional information that came out today that I think that it'll be important to just kind of think about. Just want to make sure you're aware of everything. Governor Ducey did share that he has an additional grant option, which our district would receive 1.8 million. But in that grant, he does stipulate that we would have to be in compliance with the law of not mandating any masks by August 27th. Don't know what that actually means, as far as we know that there's so many things kind of up in the air in relation to that. 2 things to consider also as you're discussing tonight is if you did decide that you wanted to do this, what would be the start date? I would ask to give us like a day or so that we could get proper communication out and prepare our special needs students. And then if you would be considering an opt-out option, as some other districts have done before. Last week, the Maricopa County Department of Health also shared that there is an additional exception for children for quarantining if they were masked and they were within 3 to 6 feet of each other. So potentially by having students masked, we could reduce those numbers of quarantine that are at such a high rate currently to maybe a lower rate. So that's all the information that I have for you tonight.
Thank you, Superintendent Gunning. I appreciate that. I will open the floor for discussion. Again, on the agenda is masks, obviously face coverings and whether they should be required or not, as well as the reopening plan as a whole. So the floor is open for comments and discussion.
I have, a lot of letters, and I've tried to respond to them today. It's like a flurry that is overwhelming, but everyone has the right to and should do everything possible with hygiene to protect their children. I mean, how could you not? And I think everyone has the right to take whatever measures are necessary. I think that if certainly, if parents feel strongly about masks, they should wear them. There are a lot of people that are opposed to it, especially, for instance, when children are outside, they're doing athletics. It's probably arguably more harm. I think that we're not experts. I think the legislature, I don't think Ducey made this. Maybe he did, I don't know, but I'm sure they used a lot of input and a lot of data. So in a sense, if we're doing a mandate, I think we'd either be doing it for just the next 6 weeks, or it would be intending to break the law by continuing. I don't recommend that. And the other thing is, I've noticed some schools have done an opt-out, but since Ducey's come out with this financial, essentially, incentive for not making a mask mandate, I think the opt-out is kind of a moot point, because the way I see it, you still would have a mask mandate with an opt-out is actually kind of not a mandate. It's kind of like your choice, but yet you still would be considered technically having a mandate, so you'd lose the funding. So if you were going to go that route, it would be probably better to not have not have any kind of mandate at all. And if we did do a mandate also, I think it should be eliminated outside, as I just said. And also it should end by 9/29 when the law takes effect, so that we're not saying as a district, we're trying to, go against, the governor and the law, that kind of thing. But, that's about it. I don't think that it's an issue that's very powerful. People should be able to take care of their children, but we're not experts. There are other people probably have more expertise.
Thank you, Jeremy. I agree with a lot of what you said in terms of, things that are going on sort of in the world of politics with the governor and some of the grants and other things that he's doing to incentivize districts to make certain decisions. I'm interested in that. I don't know that we have this because I know it just came out today, but I'm interested in the clarification on incentivizing the districts that are not breaking the law. Because from what I understand, that we would not be breaking the law if we required masks until September 28th. Is that correct? Can anyone verify that for me?
I don't know if we can absolutely verify it. I mean, that was our understanding based on the judge's ruling yesterday. But then having this new information today, I haven't received anything like very definitive just yet. Mm-hmm. So that could be something that could come later this week or even next week. I know Wendy just received the initial information regarding the grant, and that's really all we have right now.
Okay. Okay. Any other comments?
I think that we need to do whatever we can to help mitigate the spread in our schools that's happening right now. We have more cases than we've ever had in a week, and we've only been in school, like this is week 3, but for the data we have through 2 weeks, we had more cases than we ever had in a single week last year when kids were wearing masks. And so we need to do what we can do. I totally understand the idea of having it go until like through the 28th, and then us discussing it again, depending on what happens with the other lawsuit that's been filed by ASBA and everybody else, because we don't want to be in violation of the law, but we also want to protect our students because they are getting COVID. So I think that we need to do whatever we need to do right now. And I would not support an opt-out because of the fact that I agree with Jeremy. That's basically not having a mask mandate, because if people don't want to do it, they just won't, and they'll fill out paperwork. And I don't agree. I know Dr. Armstead mentioned before, people don't want to do the paperwork, but I think that we will have a lot of people who do the paperwork. And based on just even the emails we've gotten the past 2 days, I think we have a lot more support than we thought we did to have a mask mandate.
I just would like to rebut. I'm not against an opt-out. I'm just saying, if you're going to have an opt-out, I think if you do it, I think you should have an opt-out. It's just, if you're going to do it and have an opt-out, then you might as well not have a mandate, and I kind of I'm kind of along the idea that we're a free country. People are intelligent. And I wanted to add one other thing. I think that I know that a lot of measures are being taken, and I encourage that. I mean, I think every child should be check their temperature every day coming to school, just, with a little infrared temperature reader. And certainly maybe some strong repercussions that, for sending a child to school that's sick. I know a child might be healthy in the morning and show symptoms later, but I think that should be very strict, because the whole idea of the mask, really, I think everybody agrees that the only real protection they do is that if a child is sick from them, coughing or sneezing and putting big droplets out there, which the mask would stop. And I think we all agree on that. So another way of looking at it would be just to make sure there are no kids that are could spread it and are sick, and not just COVID, anything. We don't need sore throats and earaches and flu and anything else running around the school either.
Jodi, can you please confirm? I just want to confirm what Jeremy's saying. So the mitigation that he's suggesting in certain terms of the temperature taking and the strategies with parents sending their kids to school. I was not under the impression that we were doing that for kids that are coming to campus. Is that in fact what's happening?
Correct. We've asked the parents, they sign off on a checklist stating that they'll take that on, that they're checking their child prior to sending them to school to make sure that they don't have a temperature, and then that they don't have any signs or symptoms.
Do we have infrared checking? I mean, you go in an office building and the security guard aims a thing at you, or even those infrared cameras that are hooked up to a thing. I mean, just walk there, stand there a second, and it tells you right then and there. But I know the little infrared guns. I mean, I've got 4 of them. I mean, they're now on eBay for like $12, the little orange ones, which will give you a pretty good idea of whether somebody's got a fever.
Mm-hmm. I know we've had some, we've added some of those I don't know if they're exactly infrared, but some that are the touchless thermometers that we've added to the nurses' stations. When we talked to Dr. Moran last year in regards to that, she just thought that you're not really getting the bang for your buck as far as having to, like, for a large campus that has 1,000 kids, to try to do a temperature check on every single child coming in. So she said, usually there's other signs and symptoms besides just a fever. So she thought having the parents do that checklist ahead of time was sufficient to say that their child's not sick.
Well, I think some parents sometimes, I mean, they have to work, and, they're going to a little wishful thinking, maybe, but I understand to have 1,000 kids go through the door in the morning, but maybe if each school had 2 or 3 inexpensive, infrared devices, and maybe they got kind of passed around. So, at the beginning of the day, all the classrooms on one, it would just be passed around from teacher to teacher during the day. So each child would be scanned once or twice, at least once during the day. I think that would be very feasible, as long as it was staggered, throughout the day, and certainly would be a lot better than nothing, and very doable. And secondly, it's objective. I mean, you can't assume that parents are, I mean, they're running off to work, they got other issues or whatever. And, like I said, I think a lot of parents are going to be wishful thinking that their child is okay because they don't have a means to take care of them for the day,
Yeah, I agree with that, Mr. Honak. I think that, parents do sometimes feel like their hands are tied, and that they do unfortunately, send their kids to send their kids to school when they might not be feeling well. And so really to reiterate your point, I think, passing around an infrared temperature check, at that point, it would be too late. If we're not requiring masks, then that child might be sick and then would have, potentially spread it if they're not getting their temperature checked till, 1 o'clock or 2 o'clock in the afternoon. So my top priority as a school board member is the same tonight as it always is, which is student success. Being in the classroom in person with teacher-led instruction is the best decision for student success. And if masks can help reduce the number of children who must quarantine, which we currently are at 500, almost 500 people who are quarantining, if masks can help protect against that and keep students in class in person, that seems to me to be in the best interest of all student success.
Kim, this is Danielle. I would agree with that. I mean, I think, everyone learned a very hard lesson last year with the various scenarios and having, virtual learning and all of that. I think we did the very best we could with the situation at hand. But I think we also learned that if we have the availability to keep kids in school, the majority of kids in school, the majority number of days, that's what we all want. I think I've heard all of us say that at different points in time. So just to reiterate, Jodi, from your earlier presentation, if there is a requirement for children to wear masks and there is a positive case in their classroom, it is the guidance of Maricopa County or Department of Health Services, I'm not sure you can clarify that, that says those students, if the mask is worn effectively, do not have to quarantine for the 10 or 14 days that they're currently quarantining, because they are in agreement that the mask is sufficient to protect those kids from possible exposure. So we would, by wearing a mask, we could potentially limit, or most probably limit, the number of quarantines that we have right now. Is that an accurate statement?
Yes, we could limit as long as they were within 3 to 6 feet, no closer than 3 feet to an infected student. So that would definitely have, because right now it's 6 feet.
Okay.
And, within 6 feet. So this helps because a lot of our classrooms, they can spread apart as much as possible, but they can't quite get to 6 feet. So I would say the majority are within 3 feet. I know there are some classrooms that are just a little bit fuller. So of course they're doing the best they can, but this I think would definitely help. And then, sorry, I also just wanted to say that CDC does not currently recommend that schools conduct the symptom screenings for students in grades K through 12, but strongly encourage, parents and caregivers to monitor their children and to not send anyone to school sick.
I think.
I'm sorry, Jeremy, we can't hear you.
Here I am. Thank you very much. I see that I was muting. I was changing microphone. So I think that it's, the choice between not coming to school and wearing a mask would be better to come to school, but I don't think it's just a binary choice. I think that, the fact that I don't think it would take till 1 o'clock to test all the kids. And I think, I don't know how long this is going to go on. I mean, the world is changing. I mean, diseases coming from all over the world. We got 1 million or 2 people coming from the southern border that have not been tested, and nobody is testing, and they're bringing who knows what with them all over. So I think that as the responsible thing to do is for this technology, just a little infrared gun. Like I said, they're dirt cheap, and how many classrooms? If you had one for each classroom, a teacher could zap everybody, in a couple of minutes as they come into the room. I mean, she could walk around the room, be doing it while, I'm just saying it could be transparent amount of time and done. And I think it's, I think that's really should be done anyway. I just think that's something that, you're in a situation where, a lot of kids, younger kids are Petri dishes, and, it really, you couldn't have done it 10 years ago. Infrared thing costs thousands of dollars. Today they're 15, $20. I can't believe there wouldn't be some money out there somewhere from the Department of Health or whatever to outfit this. If it isn't, somebody ought to make some phone calls so that the school does have some additional tools. Let's say that a child comes to school and is sick and they wear a mask and they got a runny nose and they scratch, and they're touching stuff. I mean, you still got a sick kid. They're still going to spread germs. And the mask isn't going to stop any of that. So I don't think it's a binary choice. I think you sit and look at this as masks, and the other thing is rapid COVID test. And I know that maybe would be more of an expense, but I think that the infrared gun is you're talking to something $20, $30, I don't know what quantity. It's nothing financially.
Superintendent Gunning, I'm sorry, Jeremy, I didn't mean to interrupt. I was just going to ask, kind of follow up on your comment in regards to testing. What, Jodi, can you give us any updates on what testing might be available? I know testing is an option for students to return from quarantine as well. So what are the district's options in terms of testing on campus or by a nurse or someone like that on campus to mitigate some of this? Is that something we should also be talking about?
So I'll turn it over to Gina so that she can update you on the testing kits that we currently have. It's not done on campus. It's a take-home kit that a parent could opt to take home.
Okay, thank you.
Thank you, Superintendent Gunning. Good evening, everyone. We have the Binax Now at-home test kits, the same ones that you'll see at Walgreens and CVS. It's a 2-pack of kits that we got from Maricopa County Health Department on very limited supply. So each school has received 12 kits, but the health department has asked us to divide those out so that when we're sending them home, we're only sending home 1 test per family or per person, actually. So that's how we're doing it. Like I said, 24 tests in total per school. When we run out or we get low, we will order more, but they're taking them home, they're testing, and if they come back with a negative test after they have quarantined, so they can test on the 6th day after the 5th full day, they could come back on the 8th day. So that's the early test out option.
So how are you going to do that when you got 400 kids in quarantine right now with just a few test kits?
Well, it's right now, it's Maricopa County Health Department. It's their program. And we got as many as we could. They're limiting how many every district can start off with, since it's a brand new program and they want to make sure that they get a little bit to everyone. So we're just, it's really a nice courtesy that we're able to offer parents until they're gone. And then once the test kits are gone, we'll order more. We'll try to keep them in stock as much as we can, but it's all depending on the health department's supply. Otherwise, parents would have to go to the drugstore or to one of the testing sites in order to get the test done to do the early return.
I'm looking at Amazon, infrared forehead thermometer, $17.74. Wow. You don't think we could afford that for each class, or $24 for
Mr. Honak, that does not address all of the symptoms of COVID-19, and not every person who has COVID-19 has a fever. So that alone is really not a mitigation strategy. That could definitely be a layer of our mitigation strategy, and I'm certainly open to hearing that. But again, to your point, it's not binary. It shouldn't be either or, but maybe that is something that we could talk about once we know what the total dollar amount would be. It seems like nothing for one classroom, but we have hundreds of classrooms.
Dr. Armstead, I want to open the conversation to you. We haven't heard from you yet. I'd love to hear some comments or feedback from you.
Yeah, so first of all, I kind of shared what my thoughts were last week on Tuesday, that there definitely should be something put in place with masks, because our numbers are continuing to grow as far as active cases. We have a lot of students who don't have the option to be online for various reasons, but I would not support putting in an all-out mandate without an option to opt out. And the reason for that is because if there's truly a significant amount of people, meaning staff and students, that would feel safer with those masks, then you're still allowing those who do not want to send their child with those masks for various reasons the choice and the ability to opt out. So I absolutely would not agree with just saying everybody has to do something. You cannot opt out your child, or basically that's sending the message that either you do this or you can get out of this district, which is not what I believe we should be trying to send right now. But also with the option to opt out, it allows for those students who are the families who are opting out, not for personal reasons, but for like our students who would struggle with hearing with the mask on, or our kinders, thinking about our primary students who, when you're thinking about reading and writing, it is very difficult to learn with, the mask on. So those teachers who feel like, I'm going to take that risk and I'm going to have this mask off when I'm close, but I'm aware it, that gives people an option. And I think that's the most important thing right now that we need to be thinking about, is the safety and also the well-being of our students in the classroom, because I have seen an absolute shift in a lot of students for being in person. But if we're just saying either we're not going to mandate masks or we are going to mandate masks, I fear that there's going to be an exodus either way, because some parents are going to say, I'm a parent, I feel like you're taking my rights, my children are no longer in this district. Or if we do not mandate it at all, you'll still have parents that feel like you're not protecting my child and therefore I'm taking them out of this district. So I don't think the discussion is necessarily on how we go about this, whether we're adding the infrared to take temperatures or whatever we're doing, but focusing on the fact that either way that we go, we want to make sure that it keeps students in the classroom and it keeps our community trusting in us as a district. And if we don't have an option to opt out, I truly believe that we're going to lose a lot of trust in this community. And so it's important that we put that in place. In regards to taking temperatures as a teacher, I know that I would not mind doing that, but I was given guidance by my district that, just like Superintendent Gunning said, we are not allowed to do that anymore. That has pretty much been taken out of the equation. So even if we did purchase those tools and different things, I know myself as an educator, I'm not allowed to do that. And even though some parents may, they're busy, they have things going on, or they just choose not to take their child's temperature, again, we have to build trust right now. So if that child gets sent to school and that parent did not know necessarily that they were sick or that they had these symptoms that they might have thought were just allergies, I think now is the time for us to give grace and build trust and take those parameters then, like cross that bridge when we get there, but not to put something in place that is an iron fist that says you do what we want you to do or we don't care. Because even suggesting for students to go to the online digital academy, there are so many parents that cannot do that. We are forgetting that some parents weren't working through the pandemic, so they can't afford to not work right now. So having that option to opt out is showing the community, both sides of the community, we are here to protect your child. That's why we're asking that you wear these masks, but we also want to allow you to have the option to make the choice that you want to for your child. And on that document, it can say your signature is recognition that you have clearly opted out of this mask mandate, so that those individuals cannot come and blame the districts if their child contracts COVID-19. but yeah, I just think that we need to focus on a way that's going to protect our children, our students, but also is not going to break the trust, because we already have so many reasons to, you know, be separated. Like, this shouldn't be something that creates more of a mistrust in our community.
I think that that's very well stated. I mean, as I said, I didn't sound like I was for the option, but if we're going to do the mandate, I definitely think there should be the option for the same reasons. I think that there's so many parents that are very upset and considering taking their kids out or already have. And so I think that there needs that option. And there are kids that have, you know, asthma, have different situations, you know, that are, anyway, I think I've already said enough.
Dr. Armstead, thank you for your comments. I just wanted to clarify before we moved off from the opt-out. So I just want to make sure, when you're suggesting the opt-out, is that a blanket opt-out for anyone who wants to, or are you saying an opt-out, you know, if they have health reasons or there's special education or there's specific reasons, or really just a blanket opt-out that parents could choose, you know, and not have to sort of qualify what that reason is?
Well, basically the term you use would be like a blanket opt-out. I don't feel like we should be asking specifics, because then we could get into violations of HIPAA and all that stuff. But I mean, it's pretty much known that some students they're going to struggle if they have to be behind a mask or listen to someone speaking behind a mask all day. And I would hate to see that students are still not successful in the classroom because they were too afraid to speak up and say, I can't hear you. So, I mean, the opt-out is just literally for the staff and the families to say, you know, for whatever reason, you don't have to tell me, I'm not going to wear the mask. But there's also an option that if they want to go back to wearing that mask, then they could go and, you know, change that as well.
Great, thank you. I just wanted to clarify. I want to make sure I understood what you're saying. Superintendent Gunning, I'd like to hear from you as well. What are your feelings? What is your recommendation as a perspective from the staff and from the district? How are you and your team feeling about this?
Well, I think, as you can kind of see, I think everybody is feeling, you know, kind of both sides, right? They understand the importance and definitely are feeling the pain of how many children are being quarantined and isolated right now. I think that's a hard piece. But then I also think that a lot of staff also, you know, supports the families in making decisions. So I think that's where it's been, you know, a little bit difficult. I would say if you're doing a mask mandate, I would like some form of an opt-out option, just so that for those families. I do think that the majority of children will and families will follow whatever rules we put in place. And then for the few that you know want another option, they would have that.
Okay, so you're in favor of the masks with the opt-out clause that Dr. Armstead was referring to make sure that we offer choice.
Correct. But I will support in whichever way everyone chooses.
Okay.
I have a question in regards to the students who are currently in quarantine. If this, depending on how this meeting ends, what is the next step for those students? So like the students who have been quarantined for a week, and you know, now we're saying, oh, if you get this test and it comes up negative, it's the 8 days or 7 days or whatever it is. How is that communication going to go forth? Because does that mean that these students will now be able to get that, and if they're negative, they can return tomorrow or at the end of this week? Or is this going from this point forward?
So Dr. Armstead, that piece was already in place and is communicated in the letters that go home to the parents, so that they know exactly which dates they can test and then can bring back in that test. So that's something that was already in place. So that part is not a change. The only change that would be is from the quarantining decide from this point forward in relation to wearing a mask that you wouldn't have to quarantine if you were 3 feet or greater away. Now, we would still always notify a parent. So I want to make sure that people know that it would just be an indirect contact letter. So the parent could choose at that time if they felt that they did need to quarantine their child.
And remember, Superintendent Gunning, let me just clarify one thing. And remember, the person who is tested positive would need to have had a mask on, and the person, that you're speaking of. So that it's both, and that is clearly described in the letter from the health department.
So I guess I'm still confused, and you can tell me if I'm like misunderstanding. Those students who might be in quarantine now that were wearing a mask, will they have to complete that 10-day, or will this change now? They can come and prove, I guess their parents can prove they had a mask on and met that space requirement to come back to school. I guess that's where I'm confused. How does that work out?
I would say that we would just follow through with whatever we had originally communicated with the parents. We did, as we took in additional information in relation to the masks. If both parties were wearing a mask, then we sent home the indirect letter already, and the child did not have to quarantine. Only the child who was positive had to isolate. So we kind of started that small piece of it, but we knew that if we did have a mask mandate, that would grow in the number of kids. But we would just take it from this point forward, because I think it would be too difficult to figure out. And they're probably coming up to the end of their quarantine anyway, trying to go backwards to see if was there anyone that would need to change? I mean, Megan, you can chime in too.
Yes, I agree. So the county health department came out with their letter last Thursday that stated the mask requirement, or the mask option to not have to quarantine. And so we put it in place immediately after that. Well, actually Monday, while we got the letters out to the nurses and got the nurses trained. So from that point forward, we were deciding to move forward with the health department's guidance in that area. Because remember, before that, we were really unsure on that in regards to some of the things from the governor and different things. So we waited until the health department made their stance and came out clearly with their brand new letters. So that started on Monday.
Okay, thank you.
I have 2 questions. One, if we did an opt-out, how are we going to be able to differentiate between the kids that have opted out and haven't opted out? Would be my first question.
So that, Melissa, we would, board members item, we would have to work through that piece. So that would be, depending on what happens tonight, we would have to pull together a meeting with all of our principals tomorrow to work through how we would handle it. I think it would have to be at the school level, because they know the kids. I mean, we wouldn't be able to handle it here, because we wouldn't be seeing the children on a day-to-day basis. So it'd have to be something at the school level, but I would need to really get the input from the principals on how that would be managed.
Okay, and my second question is to clarify, both students have to be wearing a mask if there's a COVID exposure, for them to not have to quarantine, like for the student that didn't have it to not have to quarantine. So are we really going to be cutting down the number of quarantines if we allow students to be opted out of our quarantine? Or out of our mask mandate?
I think it would, it has helped us already since the health department put that in place with just a few kids. It's helped because when they were both wearing, so as long as the person who has COVID and then anyone else in their group or nearby area has a mask, they do not have to quarantine. But anyone who did not have a mask that was near them, not the one who is, I know this is so confusing, they would have to quarantine. So it has helped already. So I can only imagine that if we're asking people to wear masks, then I think more people will be wearing them, which I think would help with the quarantining.
Ultimately, it'll depend on how many people opt out as to how affect our quarantines.
I was just going to share. Melissa asked the question, how would we distinguish the students who have opted out and those who have not? I know that in my district, that was a question that I had for my administrator. And the way that it's being done is that it is basically the forms come through the office so that it can be verified. Like they don't need to have, all these forms like birth certificate and stuff like that, but to verify that it is the parents opting the student out. And that goes into the system so that on the roster, the teacher's roster, they will know in however way they put it on there, which students opted out. So now the teachers know, and obviously that means for special areas who have access to all classes, they would know too, based on the roster in the system. So it wouldn't be up to a teacher to go through and ask the child or something like that. It would actually be in the system that family came in and opted that child out, the same way it would be with the staff. I don't know if that makes sense.
It does. Dr. Armstead, can I ask a question on that next thing? Because I know we'll be brainstorming, but if you already have ideas on this. So then if a teacher comes across a student that did not opt out and does not have a mask on, what is your school doing? What are the procedures for that?
They have masks in the office, like they've been donated or access masks. And so they would just send the child to the nurse the same way they would if a child was out of dress code. So they would send that child to the nurse would give them a mask, and the child would be sent back down to the classroom. And then obviously if it was a situation where it happened multiple times, then contact would be made with the family so that the family can either say, yes, please make sure my child has a mask on, or you know what, I'm gonna go ahead and opt out. Where do I get the paperwork?
Got it. Thank you, Dr. Armstead.
Okay. Are there any other questions or comments or discussion on this in particular, at least that we can answer? I do think that, this is going to be an ever-changing thing, kind of as we move forward, and operationally, Superintendent Gunning and her team is going to have to figure out how this is going to work. So what I would like to clarify, and I think Jerry mentioned it earlier, but I don't think we really talked about it as a group as we went around, is if in fact, when we get to the voting part here in just a little bit, if in fact there is an option for a mandate on the books, my suggestion would be that we reconvene prior to the September 28th or 29th, deadline, because I agree with Melissa, what Melissa said earlier, in that, it's not my intention to be unlawful. And, as far as we know, and as far as we have been told and instructed, that we are not doing that up until the 28th of September. So I just wanted to put that out there in the discussion, that I do think if we proceed with that vote this evening, I'd like for it to include an option for us to reconvene on this topic prior to that deadline.
Well, I think you've got to, because if you don't, then you're clearly, leaving the possibility that you are going to break the law. So I think it'd be better to just put an end date on it, and then you're in compliance, and then that forces us to set another date. And I'm looking at here at these thermometers. I mean, there's like $10 including shipping, and they're pretty good. They've got a lot of settings. They're easy to use. And so I think that we also should, even with several hundreds, with a lot of classrooms, you're talking about not very much money. And so I think we should definitely look into that, because it's another tool, and everything we're discussing has little cracks in it of things that could slip through. And if this tool is so cheap, it's crazy to not have it, even if it's not, used all the time. But it would be a quick thing for, a teach. It's another tool, and there's really no reason why everybody couldn't be checked every day if there's enough of them. So if we could just also look into that, resolve to look into that as another tool, there's really nothing to lose doing that.
Superintendent Gunning, would you take that advisement and just do some research with your team on the guidance in using them, how operationally that might work, and how much that would cost for the district?
Sure, we can
Okay.
research that for you.
Thank you. And if you'll just let, send that back out so that the board has that information so that we can move forward with that also. Thank you, Jeremy.
Thank you.
Okay, so I want to open the floor one last time for comments, discussion. I think we've talked about all the different elements in terms of cases and quarantine numbers and our overall goals. It seems like we're in agreement, or we have built consensus around the idea that we want as many kids in school for as long as possible. Limit the number of quarantines, obviously limit the exposure to COVID-19, whether it's community spread or things that are happening in school, and which I think obviously are all good things. So I will now entertain a motion to move forward. There's a couple of different things that have been on the table. Obviously, a mask requirement up until the date of September 28th, with the board reconvening prior to that to discuss. We have also talked about opt-out options, potentially, what that might look like, a statement that parents or caregivers, guardians could sign. And also some other, mitigation strategies in terms of the testing and the thermometers and things like that, which Superintendent Gunning has said she will research and provide us information on. So I'll open the floor for any motions.
I move to approve a mask mandate with a blanket opt-out clause, the exact specifications to be determined by Superintendent Gunning and her team, to be in effect as soon as logistically possible, and to expire on September 28th.
I would like to add that for athletic activities outside, that there should be an opt-out also for the student to opt out during an exercise outside, as long as certain criteria are met, like distance or whatever.
May I
So,
clarify something?
Jeremy, do you mean the recess and physical education and things when kids are outside of the school building?
Yes, that's what I meant.
Okay.
Yeah, this would only be for inside the building, Jeremy. But good job bringing that up so that people know the clarification.
Okay, so I can clarify that. So if we could just add that I move for a mask mandate while indoors. If we could just add that while indoors piece.
Okay.
And I think that motion might still stand.
Yes, absolutely. So the motion on the table stands with the amendment that it is indoor requirement only.
Is there any way possible to put a date on it instead of just saying logistically possible? I'm just thinking about the community. Is there a way to obviously it's not going to be starting tomorrow because we don't have that paperwork for the opt-out, but is there a way that we could add a definitive date?
Superintendent Gunning, can you give us an idea? I don't mean to put you on the spot, but could you give us an idea? Would Friday, Monday? I mean, obviously, I think the purpose is to do this quickly, but what would operationally be feasible for your team to make this happen should this pass?
I think we could do it by Friday.
Okay. Kim, would you mind amending that just one more time before we move to a second?
Yes, I'd actually like to amend it to say Thursday. I would have liked to have, I would have liked to have had this discussion last Friday, but that did not happen. So I will amend my motion to say that it would be in effect beginning August 19th. Again, set to expire unless the board takes other action on September 28th.
Second.
Okay. To clarify, there is a motion and a second on the table. Indoor mask mandate starting Thursday, August 19th, ending Tuesday, September 28th, unless otherwise advised by the board.
With a blanket opt-out policy.
Thank you. With a blanket opt-out policy. That is the motion on the table. Does everybody understand?
For students and staff.
Correct. For students and staff.
Okay.
Anyone inside the building?
I have a question. Am I allowed to ask a question now? There's a motion in a second.
Yes, you may ask a question, of course.
About the blanket opt-out for students and staff. That means that all other guests coming on our campus, when we have board meetings, if there's events, they have to wear masks.
Correct. That is what I take that to mean. Anyone that is inside the building that has not filled out that paperwork. Does anyone else have any other understanding of that?
I could check on clarity in regards to board meetings, but yeah, any visitors being on campus would.
Yeah, I mean, I would assume that our board meetings are on one of our campuses. So I would assume that any indoor, meeting or anything with visitors on our campus would all be treated the same. Sure. Okay, motion and a second. All those in favor?
Aye.
Aye. Any opposed? Motion carries. Thank you guys very much. I appreciate it. I will entertain a motion for adjournment if there's no other conversation.
I motion to adjourn.
I will second that. All those in favor?
Aye.
Aye. Any opposed? Motion carries. We are adjourned. Thank you, everyone. Have a very good evening. I appreciate your time tonight.
Thank you.